From SiriusXM's Doctor Radio, this is Coronavirus. Everything you need to know now.
From the Healthy Aging Show, here's Dr. Michael Perskin.
Joan, you know, I've been a apostle for exercise for many years now and telling my patients that this is really what they need to do for their general health and their blood pressure, their bones, all these things.
Absolutely.
So this is just another thing. And then further, of course, it's a good anxiety reliever, and people are cooped up in their homes. One of your skills and talents, in my opinion, is motivating people to kind of get moving and do something for themselves. And walking outside is really the most basic, simple way to do it. Many people do that, but I think you have to be purposeful about it. And so I have some kind of specific questions, but I want to hear you to explore a little bit about calisthenics before you run. So why would you do that, and specifically, what does that mean?
Well, the first thing I do is I bring my coffee back to bed and I read in the morning. So by the time I get out of bed, my back is a little bit like touchy and whatever. Right. And I want to wake my muscles up. So I do 20 deep squats. It turns out the toilet seat of my bathroom is just low enough to measure a really good full range of motion for a squat. And when I'm doing them, no other weight, just my body weight, you can feel the muscles around your hips, your glutes in your butt, and your thighs starting to wake up. You feel the circulation start to go to them. And when you do that when you do a squat, which, Michael, you may remember is my number one exercise, functional exercise for life, you do a little sort of a pelvic tilt right at the top of the movement so that you get your low back stretched out at the same time that you're waking up your leg muscles. So I find that really helps warm me up. It just helps to move, your body a little bit before you go out and if you're going to do an aerobic workout of some kind.
Yeah.
Well, we want to aspire to do our minimum 3 times a week of 20 minutes of cardio exercise, and really 45 minutes 4 times a week would be better. Recent studies have also shown that if you're not able to get outside, and people may not be able to safely get outside these days, that just walking, even in your home, not monitoring intensity, just getting the steps in. If you get more than 4,000 steps in, just even walking around your apartment or your living room, that you reduce your risk of mortality. So I just want to say that whereas normally we would say that exercise should be effortful, and especially as we're getting older, we need to work a little harder, and I believe all that. However, there are times when it's not possible or it's not safe for us to do that. So there are times when you back off a little bit and maybe you just watch your iPhone tracker or your Fitbit or whatever, and make sure you get at least the 4,000 steps if you are confined to an inside space.
Yeah, I think that's really good advice, and I like doing the calisthenics, and this is probably a good segue in your book, Joan, Strength Training Exercises for Women. So you talk about these sort of essential things. So a squat, as you say, is, to describe it, is you spread your feet sort of a little more than hip width apart, and you get your butt as close to the floor as you can without hurting your knees, essentially. And
exactly.
you might need to lean your back against the wall, which would be like an assisted squat if you're not very strong in your legs.
Right, and some people just do what we call a sit-to-stand squat, which is getting up from a chair. And even my clients who have been in their 90s and sometimes in wheelchairs can do 10 sit-to-stands, meaning you start in a sitting position, because that's a movement that we need throughout life to get up from a chair or from the toilet or the bathtub.
What are some of the other exercises?
So push-ups.
Yes.
And push-ups, the squats work 3 major muscle groups of the lower body, the glutes, the hamstrings, and the quads. So it's a very efficient exercise to do. And just as efficient for the upper body is a push-up because it works 3 major muscles of the upper body, the chest, the front of the shoulder, and the tricep and the back of the upper arm. So between those 2 exercises, you have 6 muscle groups that you're targeting. And push-ups, again, can be a variation. You don't have to get down to the floor. You can do them against a wall in a standing position. I actually like to do mine against the bathroom sink because after I brush my teeth, I think to do a series of push-ups changing the position of my arms.
Wow, you
because
like
the
bathroom
position...
exercise.
I like
that
what's
says.
convenient.
Yes.
It's really true.
Well, the one thing, Joan, I have a thing as a geriatrician, bathroom sinks might not be the best for most people. You got to be really careful because if you're barefoot or not and the floor's wet or the sink's unsteady, that's how people fall down sometimes in the hospital using the sink as a lever to help them get up from the toilet. So I'd be careful with that one. But you're advanced, so that's a little different for you.
Right.
But,
so maybe a wall push-up.
Yeah,
maybe
a wall push-up or a
you...
kitchen counter. I like the kitchen counter because that's not a
kitchen
movable.
counter is great, and it's just as effective. As your body's on the diagonal, it's actually more effective than a wall push-up where your body is parallel to the wall.
And
You want to get a little more body weight on your upper body, so the diagonal push-up is great.
And what's the other one?
So the third one would be a back extension, where you're actually doing a back bend. To stimulate the muscles that run along the length of the spine. Also very good for osteoporosis and for reversing the forward posture that we tend to develop over time.
Yes.
And then some sort of an abdominal compression, whether you're doing a variation of a crunch or a pelvic tilt or a plank, but some exercise where you're actually scooping your abs, drawing your navel back towards your spine and flattening your belly so that you're actually working those abdominal muscles. And between those 4 exercises, squats, push-ups, back extension, and abdominal compression, you have a mini full-body workout that you can do anytime, any place with no equipment.
And
it is resistance training. Using your body weight is resistance training.
Yeah, well, I think this is all great, and the key thing is motivating people, and sometimes fear is a good motivating factor. So people want to, they don't want to lose their health, and they're worried about this particular pandemic virus, as they should be. So that may motivate some people to exercise, which I think is really important for the rest of your life and health once we get past this. I'm speaking with Joan Pagano. She's an exercise physiologist and the author of Strength Training Exercises for Women. Now, Joan, so what you described is sort of the basics and you can do with no equipment other than your own body and some furniture, which is awesome. And you could do even more, right? You could even just march in place, which is kind of more than just walking, right? That's kind of good for your hips
accumulating those steps. Yes, you're right, working the hip flexors, getting your heart rate up a little bit higher than if you're just ambling around your living room.
Yeah, there's all sorts of different ways you can walk. Also, you can do like quick. You can do sort of a little dance step, quick, slow. You can do all sorts of little things which will help your balance because you've got to manipulate your body a little bit to do that.
Great point.
Yeah.
I'd like to know what you're doing.
Well, I'm going to tell you. So what happened with me was I have not run outside in at least 20 years because every time I tried to, it would be too jarring for me and be uncomfortable, although I used to really enjoy running. So once they closed the gyms, and as you know, Joan, because I'm a gym rat and an exercise fiend, that was just like taking away, my drug. So that was really no good. And so I had to figure out a way I could start to run again. So what I started to do was power walk, and I have this one online company where they kind of coach you through it. And I never realized you could really make it hard. So I was always a fast walker, but the way at least this instructor described it, I kind of had to get my glutes engaged and kind of activate my pelvic floor and tilt my butt up. And boy, your butt gets sore. Your glutes.
Oh, yeah, good.
If you do that for half an hour, and then I sort of would break into a jog a little bit and do sort of intervals. Unfortunately, when I was I had run intervals, and then I was going to do a run, and then I actually got a mild case of COVID. This is about almost 4 weeks ago now. I'm fine, but the way I got it was I had it started out with these aches. And I couldn't run, and then I couldn't walk fast, and then I could only walk slow. So that was kind of a bummer for me. Now I'm on the other side of that. So I don't know if and then I got myself an indoor bike. So I don't know if I'm going to go for the running again, although I may try because I really did enjoy it. Being outside and stuff was really nice. As opposed
so maybe
to
building up on the bike, again, and then trying it.
And then the other thing that I wanted your perspective on is, there's a lot of ways to skin a cat in exercise, and one way is to use, you use weights. So, you can get some dumbbells and you can do all sorts of different things. And, there's plenty of movies and TV shows, people doing various things with free weights. But, Joan, as you know, people can hurt themselves with weights too. Because if your form is not great and you're trying to use too heavy of a weight, that's a good way, particularly for older adults, to hurt yourself, to strain or really even tear something.
Very true. It's good to get a little education from a professional, if it's possible. Even watching a video or a book like mine, where the exercises are depicted very clearly with captions on how you should be positioned for the start and finish of the movement.
So, but there's other ways to do it. So you can also, if you get some stretchy stuff, it turns out you can't really get weights shipped if they're more than like 15 pounds. I know because I tried this, Joan.
Okay.
I did get some 8-pound weights, and they were out of the 12s and 15s because I do like to use a couple of exercises with free weights. But then I realized that if I got these pull-up bands, these thick kind of rubbery things that look like fan belts,
yeah. Oh, yes.
you can do a lot with those. You can do a lot with those. The way I got the idea was I saw a guy in Central Park, and he had one around his waist, and the other end was attached to they had this hook near the park bench. I don't know if it was there for this purpose or it was there for another purpose, but he had his thick band, and he was trying to crawl against it.
Yes, I know what you're talking about. They call them monster bands or something.
Yeah.
Monster bands.
That seemed like a really good exercise for your core and stuff. That's high-level stuff. But talk a little bit about closed chain exercises and how using sort of resistance bands of one sort or another might be a good way for people to keep their muscles stronger.
Yeah, I love those resistance bands. That's the first thing I did when I moved out of my apartment in the city is I grabbed my stretch bands and my loops. Because they don't have to be as heavy duty as you're describing what you were doing or what you were seeing.
It was all different sizes. You can get light, medium, heavy, you can get everything.
Absolutely, and you can do any number of exercises. You can target every muscle that you can with free weights with the bands. They can be a little tricky to use. You have to be careful of the way you wrap them around your hands. And you need to, as always, even with whatever kind of resistance, external resistance you're using, you want to align your body properly and stabilize and hold your form while you're performing the movement that's targeting a particular muscle. So basically, we do 8 to 10 exercises that target the major muscle groups of the body. And the major muscle groups from large to small are the lower body muscles, the glutes are the biggest, and then the thighs. And then your back muscles, there are a number of the back muscles, the latissimus dorsi, the mid-back muscles, the traps, and the, oh my gosh, I just blanked on it, but anyway, the ones that go right across your shoulder blades. And then the spinal muscles, so your back muscles comprise a lot of musculature, your chest, your shoulders, your biceps, your triceps, and your lower legs. So you pick exercises when you're designing a workout, you pick exercises that will target all the major muscle groups. And that's how you design a workout at home. And then, of course, taking into consideration your medical background and any injuries that you might have had or your starting level, where you're starting off from. So
and it's usually good to start at the big core muscles and work outwards. So as an example, you wouldn't start your workout with bicep curls. Right,
because generally those muscles, the smaller muscle groups, would be involved in bigger muscle movement, so you don't want to fatigue them.
Right.
You don't want to fatigue a bicep or tricep if you're going to be using that muscle in other exercises. You want it to be able to engage with the other muscles that are, in an integrated movement. So you don't want that muscle to be exhausted before it even starts.
Now, Joan, are you connecting with your clients digitally?
I'm really not. I'm doing my writing. I'm sending out my, I have a bunch of videos. I have a very active Facebook page. I'm kind of active on social media, but my Facebook page, Joan Pagano Fitness, not my personal page, but Joan Pagano Fitness. I post a lot of videos there, and I show exercise minutes, exercises that you can learn to do watching me do them. Using the bands. I have a whole series using the bands or using free weights or using body weight. And I just try to keep a presence that way. I haven't tried any full classes on Zoom or on Facebook Live because I've just been a little disappointed with what I have seen produced in terms of production values and also limitations in using my laptop and my iPhone 6. I have sort of my own technological limitations.
Yes,
but I do have I do have a bunch of videos and of course the books, and I'm posting a lot of e-blasts now going out to my list, or anybody who wants can sign up on my website, joanpaganofitness.com, for 10 little videos, 10 free videos that you get when you just sign up on my website. You get one a day, and it shows an exercise that you can do around your house or apartment. Very easy, simple to follow exercises. So I'm doing that kind of thing.
That's great. That's great. We are speaking with Joan Pagano, exercise physiologist. Her book is Strength Training Exercises for Women, and you could just go to our Facebook page, Joan Pagano Fitness. And Joan, do you think that as people get older, though, they're fearful and they're staying in more? Is that your sense from friends or clients?
Yes. Well, because I do have older clients, a lot of them have another kind of chronic disease. I have two clients with COPD, one with dementia. There are various other heart disease.
Sure.
Osteoporosis for sure. So you have to be careful to take all of that into consideration when you're doing a program, but everybody can benefit. And you touched on something I just wanted to go back to for a second, Michael, when you said your immune system. It seems that people who are hardier are resisting the virus or not getting hit as hard as others. And I believe that when you take care of your health with the exercise and sleep and nutrition and stress management, that you are building your immune system. And that is so important. That's why the routine of self-care, like even when you are handicapped like we're limited with our choices, but you can find something to do, and you want to definitely stick to that self-care routine and make yourself as strong as possible within whatever limitations.
It's the discipline. Joan, thank you for coming on. For our listeners, that was Joan Pagano. Her book is Strength Training Exercises for Women. You can find her on Facebook. That's Joan Pagano Fitness. Thank you again, Joan, and we'll have you back soon.
Get facts, not fear, from SiriusXM's Doctor Radio. Presented by the leading experts from NYU Langone Health. To learn more about Doctor Radio, including shows and schedules, go to SiriusXM.com/Doctor Radio.